before we get started? Any questions in I don't know, about anything? It doesn't have to be of the history of massage. Yeah. I had somebody in, oh yes, please, Ms. Torres, please.
Ms. Petrie has her hand on.
Yeah, but she just left it up. Yeah.
So what is the difference between a massage therapist and a masseuse?
So in my, by the way, I'm one of the few people that feels this way. All right. In my mind, nothing. A lot of people don't like the term masseuse because they feel like it cheapens the profession. They feel like people associate masseuse with like inappropriate massage or whatever. But to be honest with you, it's just an old term for a massage therapist. And so when people are like, oh, you're a masseuse, I don't even correct them. I'm like, sure, I'm anything if you pay me. I don't care. $100 an hour, you can call me whatever you want. But people prefer massage therapist. And massage therapists, of course, they want to be therapists, right? I'm a physical therapist, a massage therapist, a structural therapist. And so they don't like the term masseuse is considered, at the very least, a very old term, at the very worst, the wrong term. So I wouldn't say it to another therapist because I know it would upset them, but I don't care.
So maybe like older people, I want to say 30s, 40s, it's like, okay, it's okay if they say the word, but when younger people say it, they're trying to mean something else because, like, even though I don't know, it kind of sounds like, yeah, they're trying to mean something else. Well,
they might. So, I mean, we've got it. I agree with you where you're going with this, I think, if I understand you correctly. Yes, by the way, if a person, an older person, and even actually much older than me, because masseuse was used a lot, like, if you're 70 or 80 now, those people, I kind of expect them to be like, oh, you're a masseuse, how cute. And I'll be like, yeah, I am, okay. Like, I don't care. And they're just being sweet. They're just using old terms. They don't know. But I think when a younger person uses it, one of two things is going on. One is they just don't know. I mean, I really don't want to leave room for just ignorance. We're all ignorant at times. And so maybe they really just are making a social faux pas. But the other thing is, you're right. They could be kind of fishing to see if you do an appropriate massage. There could be all sorts of stuff going on. Yeah. Yeah. Is that what you kind of were asking and saying?
Yeah, because I get that. Like, oh, so you're a masseuse, but then I'm like, what? No, I'm a massage therapist. Like, I don't even know, like, what does that word mean? And it doesn't sound like what we do.
Yeah.
It sounds like you're just touching bodies. I don't know.
I agree. Well, and I like to believe, I do believe, what do I mean I like to believe? I believe that what I do is therapeutic massage. I do no-nonsense therapeutic massage. And so there's no way I'm a masseuse, right? I mean, I'm doing therapy. Whether you like it or not, it's therapy. So, I mean, I get you. I get you. Miss Petrie, you raised your hand?
If somebody calls you a masseuse and then asks if you do light touch, you do not ever do a light touch massage.
Yeah.
You stay away from that word. You run.
Yeah.
You tell them to get out of the building.
Yeah.
Light
She's
touch
right.
massage means that you do sexual favors.
Yeah.
I found out the hard way. I was like, oh yeah, I mean, I do Swedish massage.
Yeah.
Yeah. I found out the hard way. It was a very bad situation. And I would throw the guy out.
Yeah. I hate to say she's right. And, by the way, release work. It's another term that people use when they're trying to kind of fish to see if you do anything inappropriate in your massage. Unfortunately. So, Miss Walker T, you have your hand up?
Yeah, thanks for sharing that information.
Yeah.
Two things to look
Yeah.
How do you become a myofascial therapist?
A myofascial therapist?
Myofascial, yeah.
So, two things. One is, legally speaking, you say you're a myofascial therapist. So your massage license, legally speaking, allows you to do myofascial work, period. Okay. Just kind of like your license allows you to do reflexology and pregnancy massage and all that kind of stuff, whether you're qualified or not, really. Once you're a massage therapist. So once you graduate this program, you can call yourself a myofascial therapist. Boom. But you could also take myofascial continuing ed. Myofascial work is really slow deep work, which you can start doing right now. To me, that is massage. It's usually work done with very little oil or dry. It's done very slow to let the tissue actually change. And that's what myofascial work is to me. To me, the lines between deep tissue and myofascial are very blurry. It's very hard. But I got to tell you, by the way, the lines between Swedish deep tissue, myofascial, everything is a little bit blurry because you start to blend them all. But anyway, yeah, take a continuing ed course. It'll make perfect sense to you after you graduate from this class. I 100% believe that. I mean, a one-day course, you'll be like, oh, I kind of already do that. Like, I get it, like what they're doing. You won't have to take a long program to be a myofascial therapist.
Okay.
That's assuming, by the way, I don't think myofascial is trademarked. Sometimes there's stuff that's trademarked, and if you don't take their training, you can't say you do it. But myofascial, I think, is just a fairly generic term.
Well, I was kind of wondering what the difference was between it, from the myofascial and the deep tissue.
There isn't. I mean, don't get me wrong, myofascial therapists would say, my gosh, there is. A deep tissue using oil and you're going kind of deep and rubbing. And that's true. Myofascial work, by the way, myofascial means muscular fascial work. What have we all been talking about for 6 months in this class? Muscles and fascia. We all know, too, that you get in there and you hold them and you slowly open them up. So the difference is myofascial work is usually dry and slower and stretchier than deep tissue. And deep tissue is kind of like a deep Swedish, I guess. But there's some similarities, and they go well together. So with Swedish, too. You thought myofascial was gentler work? Oh, well, maybe somebody's interpretation of it is.
Well, only because people who I've talked to in the past who have gotten it done, because I've never had it done personally, but I've talked to other people who have gotten it done, and they're like, oh yeah, it's very gentle. And I was like, oh, okay, that's probably not something
I think of things like skin rolling. I think of like skin rolling and all that. You sure they weren't talking about cranial sacral or something else?
Maybe.
Because it's so easy for people to get the terms confused.
It could have been cranial sacral.
Yeah, which is super gentle. Super gentle. But yeah, it's like things like skin rolling counts as myofascial work.
Okay.
Yeah. Well, I was telling Miss Walker, actually, things like skin rolling, because you're working the fascia. It's slow and pulley, and it also is a lot of like just grabbing onto something and kind of slowly stretching it out until it releases and stretches. It's just really good, slow, deep work, in my opinion.
So, deep tissue, does it not really technically involve just like sitting on an area for a while then?
No, usually, well,
movement?
Okay. I'm glad you're asking this. Let's all discuss this because we're all about to, and we're going to talk about the history of massage today, and actually, ironically, this fits in very closely. Okay. So, there are many different types of massage, and this will actually lead into our presentation today. In my very simplistic mind, and this is fairly accurate, there are two big categories of massage, Eastern and Western massage. Western is all, in my opinion, based off Swedish at some time, in a way. This very Swedish approach. And it tends to be very stretchy and circulation based. Let's rub things and let's stretch them. Eastern massage tends to be much more energetic. And let's work on the energy lines of the body. And it tends to be more pressure point work and still has stretches too. And by the way, people who practice Eastern massage would be very upset that I lumped Tuina, which is Chinese, in with Thai massage, in with Vietnamese massage, in with, right? But from a Western point of view, there's a lot of similarities to them. Between those countries and those regions, I think they'd find that insulting. But, because they'd say ours is very different. You're not getting the nuances, and it's true, I'm not. And they've been doing this forever. 5,000 years. We came along, Europeans came along 100 years ago and started kind of, well, that's not true, actually. We did some stuff back in the Greek and Roman times. But anyway, but Swedish massage came along about 100 years ago or whatever, and 200 years ago. And in Swedish massage, there's lots of strokes and stretching, which is good. So, in my mind, deep tissue in some ways is just a deep Swedish. right? We're just doing those strokes deeper. Yeah, Miss Petrie would agree. She's like, yeah, that's what she probably thinks of when she does deep tissue. It's what I think of. I'm like, okay, we're not using my fingers. I'm still doing Swedish strokes. I'm now doing them with an elbow, but it's actually just a deeper massage. All right, and then myofascial work really is actually some much more advanced work in the sense that you're slowing down. It's usually done dry, so you can grab the skin and grab the fascia, and you're really stretching it slowly, and it's done deep and slow. So it's a slightly different massage in that sense. But here's the problem with everything I just told you. Everybody takes these definitions and shapes them for themselves. So, Swedish massage got a reputation for being extremely light, and spas started putting it on their menu and saying, do you want a Swedish massage? Because they didn't want to say, do you want a light massage? They wanted to make it sound sexy, so they say, do you want a Swedish massage? Swedish massage isn't really that light to begin with. When I learned Swedish massage, it was a no-nonsense, pretty solid massage already. It might not have been deep tissue, but it was not something to be messed around with. And I learned it from a Swedish woman who was very good at it. But spas came along and started calling that Swedish massage, and they meant a light flowing kind of massage, which was kind of true. And then some spas, like the one I worked at, their deep massage they called sports massage because it sounded cool. Sports massage isn't a deep massage. Sports massage is normally done before or after, but before an athletic event to warm somebody up. And it's actually a light, brisk massage. It's light and brisk. But people started grabbing that term sports massage because it sounded cool and healthy, and so they'd use it for deep tissue sometimes. And then deep tissue, like what is deep tissue? I don't even know what deep tissue is. Deep tissue, like I said, is maybe a deep Swedish. So then people come along and start saying stuff like myotherapy, myofascial release, craniosacral release, reflexology, foot strategy release, architectural massage. They just start making up terms all over the place because they sound good. I call myself an architectural therapist. You know who invented that term? I think I did. Like maybe somebody else did, but I just thought it sounded good one day because I was like, well, I look at the architecture of the body. I wanted to sound kind of unique, and so I said, I'm an architectural massage therapist. I'm a structural massage therapist. I look at structure. But what does that mean? Right? And so it's very, very confusing out there. And for me personally, I don't ask clients like, what type of massage would you like? It's a very hard discussion to have. I do try to feel my way through that and figure out what they like. But to me, it's all massage. It's all massage. For example, pressure points I associate with Eastern massage, but do we have pressure points in Western massage? Of course we do, because ultimately we probably stole almost everything from them to begin with. Does Eastern massage ever do strokes? Sometimes they do, and sometimes they use oil, but most of the time they don't. Well, we use oil. I mean, there's only so many ways to rub a body. At what point does my Swedish all of a sudden become deep tissue? At what point am I using a lack? At what point do I have a lack of enough oil that it can be called myofascial? At what? Do you know what I mean? So I know I didn't say anything after rambling here for 5 minutes, but I guess what I'm trying to say is that it's a very open field. And unless it's copyrighted, which some people do, and then they define their massage by stealing ideas from other massages and packaging them up and giving it a name, then you can say whatever you want. And they're all therapeutic to me. I mean, to me, every massage is trying to increase flexibility one way or another, in tissue, one way or another. Either doing big stretches, little stretches, stretches with strokes, stretches with deep strokes, stretches with light strokes, get a lot of circulation in so it loosens up and stretches out, pressure point stretching. It's, you know what I mean? So I don't know if that helps.
Well, it sounds like it's very open to interpretation, especially depending on maybe who your client is or who the massage therapist is, and you know how they were taught or whatever. But it does seem like there are some buzzwords, and like that's one of those buzzwords, and I don't know. So
I love
that under things you do.
Yes, I love the myofascial buzzword because I feel it describes what I work with. I work with muscles and fascia. So myofascial to me makes perfect sense. I never liked the release word, and not for the reasons that we talked about before, but myofascial release to me makes it sound like I'm just going to release something, you know, it's going to be free by pushing something. I don't really kind of believe that. I think you're going to stretch stuff out and kind of open up a structure. So I like structural massage, myofascial massage, therapeutic massage. But you made a very good point too, Ms. Walker, which is whatever the client wants to call it, that's fine with me. It really is. I have people come in and like, I want a sports massage. I'm like, okay, so what do you kind of think? Well, I want you to get in really deep into my calves. I want you to do this thing over here. And I'm like, oh, in my head, I'm thinking that doesn't sound like sports massage, but okay, let's go do that massage that you like to call sports massage. Yeah. I mean, look at great chefs. Have you ever gone to high-end restaurants and they're like, this is blah, 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 blah. They're really stretching the name. You know, this is a decomposed cherry pie, which means they dropped it before they put it on a plate. Yeah, a deconstructed, whatever. Yeah. Okay, any other questions? Oh, Miss Torres, you have your hand up.
Yeah, even with pressure, like everybody has a different meaning of light and medium and deep. Like last time I was giving a massage to a friend and he was like, you're not even gonna ask me what pressure do I want? And I'm like, well, first of all, we need to know what pressure is medium to you, and I need to introduce you to my medium, to my light, medium, and firm to see which one you really want, right? Because I'm pretty sure your medium is not my medium.
Yeah. I think I've said this before, but if not, for your benefit, Ms. Walker, pressure is to massage like spice is to a dish. And this is along the lines of what Ms. Torres said, but for one thing, if you get the pressure wrong on a massage, it's all wrong. It's all wrong. If it's too deep for somebody who doesn't like that deep, it's wrong. And if it's too light for somebody who likes it deep, it's wrong. But Ms. Torres makes a really important point here. What does medium pressure mean? What is deep tissue? It means nothing to any of us. Any of us. I've had many clients walk in and say, I like a really deep massage, and I go to start putting oil on their back, and they're like, whoa, buddy, not that deep. And I'm like, okay. Like, I wasn't massaging yet. I was just starting to apply the oil, and you think that's too deep, and you just told me you like deep massage. And in my head, I'm like, you sound like you like light massage. And I've had people come in and say, I just like a normal, regular massage, just medium pressure, maybe even kind of on the light side. And I'm like, okay, would you like more or less pressure as I'm starting to work along? And they're like, well, you can go deeper than that. Well, you can go deeper than that. And I'm using my elbow by the end. I'm like, oh my gosh, to me, this is deep tissue. And I'm heavy-handed because we can't decide on what deep is. So, Ms. Walker, I always ask, I do what Ms. Torres does, basically. I massage them for a couple of minutes, and I say, based on what I've done so far, do you want more or less pressure? Just like if I was salting your dish or spicing your dish, I'd say, based on how your dish tastes right now, do you want more salt? No? Okay. Because none of us can agree on what's too salty, what's not enough, what's too much pressure, what's too much spice, whatever. If I tell you I have a rich friend, how much money does he make? If you're broke, you might say he makes 5 figures. That's rich to me. If you make 5 figures, you might say 6 figures. If you make 6 figures, you might say 7 figures. If you make 7 figures, you might say 8. I don't know. It's very arbitrary. So, Ms. Walker, I always ask, do you want more or less pressure after I've massaged for a couple minutes? Because that gets me to the right answer. And I don't see a difference between massages. So I just want to get the pressure right. Anybody else? Do you want more or less pressure? Probably the most important sentence in massage. Okay. And don't kid yourselves, guys. If you don't ask that question and they're not getting the pressure they want, they'll smile at you very nicely at the end because you're all adorable. And they'll say, thank you very much. No, I don't really want to rebook right now. And you'll never see them again. Ever. Because they're just too shy to say anything. They don't want to ask you to work harder. But they weren't happy and they're going to go to me. They're going to go to me and I'm going to beat them up. They're going to be like, thanks. I've gotten so many clients that way. So many clients that way where somebody's like, yeah, I liked Nancy, but she just didn't. Really? Did you ever mention it to her? Oh, I couldn't do that. She was working so hard already. Yeah, so you just stopped paying her. Stop going to her. Yeah. Wow. You know? So that's how we are. I mean, I wouldn't speak up. I've gotten massages before. I'm like, You can go a little deeper, and they're like, oh, I'm just getting warmed up, sir. Oh, okay. And then an hour later, I'm like, I just don't go back. What am I going to say? Yeah, I'm not going to beg you when I'm naked on a table to go deeper. I don't feel like I'm in a power position. Okay. Let's talk about the history of massage. Okay. Look. This book, actually, better than any other book I've read, strangely enough, has done an excellent job with the history of massage. Because it's tricky to talk about because it spontaneously occurred in multiple cultures. So the cool thing is, you know when you guys bump into your coffee table at your house or whatever, you spontaneously go down to rub your shin. Like rubbing hurt stuff seems to be a spontaneous thing that we do. Massage seems to be a natural thing that we do, and we know it's natural because it seems to have occurred spontaneous in multiple cultures. Now, in those cultures, then it spread. But it's actually spontaneously started in many, many cultures. And this book did a great job talking about it. That said, I hate history classes that make you memorize history, facts, and dates. So I'm going to highlight some big stuff that you should know, like who's the father of Swedish massage, and some really big stuff. I've underlined it in the slideshow like I have for other ones, but in this one it's more important than anything not because the facts are more important, but because I don't want to fill your head with, like, I know the third person that received a massage 45,000 years ago in this one obscure area in the world. Like, that's just not useful information to you as a massage therapist. But I do want you to know that massage has a rich history. A rich history. So, we have evidence that massage has essentially been used forever. There are cave paintings that would suggest that people were probably rubbing each other. We don't have super strong evidence of that, but we have things that would imply that. We have artifacts of Egyptians rubbing each other's feet. And so we assume they are doing massage. By the way, sometimes people erroneously call that reflexology. We have no evidence that it was reflexology, but they're rubbing each other's feet. It would make sense. People walking around on sandals would want foot massage. The first written records, though, are about 5,000 years ago. And 3000 BC, but that's 5,000 years ago, and it's in China. And the Chinese have the oldest medical records, really, that we have, and massage was part of them. And I want to say, if you ever get a chance for your continuing ed, consider taking some Eastern massage classes, because they have been doing it forever. And it's kind of neat. In our culture, massage is an afterthought, medically speaking. In most Eastern cultures, it is integrated into their medicine. It is part of their medicine. It really is. The original massage technique in the East, some of the first records we have, is something called ama. Now you'll hear people talk about shiatsu, which is the Japanese form of massage. Shiatsu is stolen from ama. Ama is the first kind of massage that we have evidence of over in that part of the world. And it's the base massage. And other cultures argue against this, but there's a lot of evidence to suggest ama started a lot of it. And then things that sprouted off that really were derivations of this massage called ama. So I've even talked to some, really good Eastern massage practitioners where I'll be like, oh my gosh, your shiatsu is really good, which is a Japanese form of massage. And they'll say, actually, I practice ama. And what they're saying is I actually practice this ancient thing that's even done before some of this other stuff. But ama is really the root of all of it, and it's just a good word to know. Ama is a pressure point based oilless massage with some moving and stretching in it. We also know that massage existed for at least 3,000 years in India, so not quite as old, but in India. And it's part of their Indian medicine, which is called Ayurveda, or Ayurvedic Medicine. So, Ayurvedic medicine is really neat. Very much like Chinese medicine, it's based on the elements and having your elements be in balance. But in Ayurvedic medicine, they call those elemental properties in people doshas. And depending on your dosha, they may try to balance out your dosha. If your dosha's got too much fire, they might try to cool it down, things like that. I could go on and on about doshas, but I don't actually want to bore you at this point. Anyway, Ayurvedic medicine included massage in India, and they have all sorts of massage and oil treatments and herbal treatments and stuff like that that go together. And it's been around forever. Like I said, ama eventually evolved into shiatsu. Shiatsu actually means finger pressure. Shiatsu is a very common term. So you'll hear people say, oh, we perform shiatsu here. A lot of spas offer shiatsu. It's kind of the cool thing. But shiatsu is a Japanese form of ama, which is a Chinese massage. Shiatsu came later. And it is a finger pressure massage. Lots and lots of pressure points. I don't think they'd appreciate me characterizing as lots and lots of pressure points, but physically speaking, that's what it is. So that's some Eastern history, really light Eastern history. Western history. In ancient Greece, Hippocrates was considered the father of Western medicine. Does anybody here familiar with the Hippocratic Oath? Nobody? Hippocratic Oath? Yes, Miss. So,
is it do no harm?
Yeah. It is an oath that doctors take, and I think you guys should take right now. Raise your right hand. No, but I think you guys should take it. It is, the first rule is to do no harm in medicine. And so it's something that I honestly think about in massage. Because sometimes I'm working on a problem like a knot. And I'm like, oh, I could just dig in there deeper and get this thing. But at some point I'm like, oh, but I might actually do more damage if I get in there deeper. And I remember my first rule, which is do no harm. So then I'm like, okay, let's see how you do with this. And I'll see you next week and we'll kind of take it from there. Because I want to make sure whatever I do in this profession, I'm sure I've had clients walk out that were disappointed and didn't get a lot out of my massage. Unfortunately, I'm sure of that. But they didn't walk out worse. They did not walk out worse. And that's super important. And the Hippocratic Oath is super important for that reason, just to bear in mind, like, when in doubt, back off. Do no harm. But anyway, he's the father of Western medicine, and he advocated massage. He was a believer in massage therapy. Yeah, that's right. Cool beans. We're not going to go into all the history of that. Bear with me. So, that's just ancient history overview. Really big highlights. Let's talk about more modern era. Like, how do we get our form of massage over here in the United States? Because it's all about us anyway, right? Per Henrik Ling. Per Henrik Ling is considered to be the father of Swedish massage. Per Henrik Ling is considered to be the father of Swedish massage. He invented something called Swedish remedial gymnastics, or Swedish remedial massage, or the Ling system. It doesn't matter. If I ask you who's the father of Swedish massage, the answer is Per Henrik Ling. And of this entire lecture from a Western, silly Western massage point of view, it's probably the name you should remember. Per Henrik Ling. I'd also remember Hippocrates, by the way, and the Hippocratic Oath, but Per Henrik Ling is the father of Swedish massage. There is some argument about that, by the way, whether he really invented the whole system and all sorts of stuff like that, but it's not worth getting into. And it's just something you should know as a massage therapist, because in some ways, the basis of most of what we do is Swedish massage. I don't think deep tissue therapists like hearing that. I don't think that, I think they've somehow got this spontaneous special thing, but I honestly think deep tissue is just an evolution of Swedish massage. A lot of the stuff that you think about in massage is in Swedish massage. Swedish massage has effleurage, remember the strokes, petrissage, the kneading, and tapotement, the striking and tapping. It's got compression, it's got pressure points, it's got range of motion. You know, it was the basis of, yeah, we can move a body around and we can rub it and we can stretch it. It's the basis of that. It really is the basis. And it's honestly the reason that we teach Swedish here, is because it makes for a great, great base to your massage to this day. And I am deep, deep, deep all the time, but every one of my strokes is actually Swedish based. They're just a derivation of that. Miss Torres.
I have something to comment.
Please.
So when I was at in the externship, I had this lady, her name was Linda, and she was like light medium pressure. So she's like, she was older. I think she's been a massage therapist for like 20 years or 30 years. And she just told me, like when people want deep pressure from me, because they want to come in and they, like you say, they want light, but then they're like, can you do more? Can you do like? They're like, she's like, the only thing I do is same, just use my thumbs and I'll just do like just press a little bit down to the skin and just go super slow, like literally really slow. It's like that will give them the same benefits as you putting your elbow in them without hurting them.
Yeah.
So that's what she does when people want more pressure, but she doesn't want to give them more pressure. She just does this super light, super slow, like really slow. And she's like, they go really happy. Yeah. But I guess some people like pain though.
No, some people do like pain, and you get these clients too. You get guys in there. I'm sorry to throw my sex in under the bus here, but we get in and we think there's something macho about deep massage, and you get some of these guys that cannot take it, and then they flex the whole time. They're tensing up like this, and it's like, dude, you're actually stopping me from getting in there. So you're absolutely right. I love what she said. It reminds me of what a student by the name of Miss Winkle, who was amazing at massage, still is. She works here in the Valley still. But Miss Winkle said, it's not how deep you go, it's how you go deep. And what she meant by that is it's actually not a pressure game. It's not really that I push harder in deep tissue. It's that I get down further. And sometimes that's just a time thing. Sometimes it's just an angle thing. Like I can press the same hardness this way as I am this way. I'm putting the same amount of pressure, but I'm going much deeper this way because I'm driving straight down. Angles are everything in deep tissue. They don't necessarily mean more pressure, right? I use the word pressure because people understand it. But sometimes I'm just changing my angles when they're asking for more pressure because I know that that's going to go in further than a flat hand. And her slow philosophy is a very good one. The other thing is when I'm trying to get a lot of work done and I think I need to be in very deep and the person's having a problem with it because it's painful, slowing down, just the act of slowing down my stroke can allow me to get the work done without actually changing my pressure. So if I have my elbow deep in your back and I'm going fast, that is much more painful if I have my elbow deep in your back and I'm going extremely slow because your tissue stretches as we go and it adapts. So actually, in a way, I'm probably exaggerating here. I've been known to do that. But in a way, I can go super deep on anybody as long as I have the time to go slow enough. Right? I can plunge into you, but I got to go really, really slow until you finally get used to me all the way in there. And then I've got to move along really slow so you get used to each step. But your tissue will take it, and you get, that's myofascial work, by the way. You get amazing work done then. But so I actually don't even necessarily always think in terms of pressure, even though I'm asking the client about pressure. I'm thinking in terms of angles and speed. Slower speeds are less painful and more therapeutic. Sharper angles are deeper and sometimes more therapeutic too. Thank you. Well said. Ms. Torres, by the way, who is the father of Swedish massage?
Per Henrik Link?
Yeah, Per Henrik Link. Thank you. Johann Metzger, I hope I'm saying that right. Honestly, I don't know. I know Johann's right. Metzger, he is the reason we have things called effleurage, petrissage, deportment, all that kind of stuff. He's the one who put French names to the Swedish movements. So maybe you haven't noticed, but Swedish massage uses French names. Effleurage is French. It's outrageously French. And petrissage, he named that stuff. So Per Henrik Link might have been the first guy to introduce Swedish massage, but Johann Metzger gave French names to the movements. And so he is part of the whole reason that it's known for what it is today. Ever heard of Florence Nightingale? Florence Nightingale was the founder. Oh, wait. Yes, you have, Miss Cooper?
Yeah, I totally have. Yeah.
Heck yeah. She's famous, actually. She founded modern day nursing. She's the original nurse. She's the OG nurse. She actually used massage. Yes, Miss Cooper.
Sorry, my computer like shorted out, but I was going to say the reason I know that is because my mom's a nurse.
Oh, so of course, yeah. She would have studied this just in becoming a nurse, the history of nursing. So Florence Nightingale is credited with modern day nursing, and she used massage as an integral part in her therapy with soldiers. So she's one of those people that popularized massage. Massage then declined, by the way, in the 1970s because they found other ways to deal with pain. Massage is an excellent, excellent painkiller. You will have many clients that come to you because drugs don't do it for them. Painkillers are actually very ineffective. They get you whippingly high, but they don't kill pain very well. And so massage for things like migraines and just chronic ghost pain, where people are like, my back just always hurts and things like that. Massage is the thing to do. But it did have a little bit of decline in the 1970s because they got better painkillers back then, and people kind of thought, oh, we can use drugs now. They're starting to turn back around because they're just finding out there just aren't really good painkillers. And talk to somebody with chronic pain, they'll tell you there aren't really good painkillers. No, don't worry about that. George Henry Taylor is a gentleman who helped make Swedish massage famous in the United States. He wrote the first American textbook on Swedish massage. So George Henry Taylor is famous for making massage famous in the U.S. He kind of brought Swedish massage over here. Made it popular. I'm not going to do that. The first massage school in the United States in 1883. Yeah. It was not online, everybody. Believe it or not. You actually had to go to class. Anyway, it was opened up in Washington, D.C. at our Capitol. It was in 1883, first massage school. Yay. Kind of cool. John Kellogg is also famous for popularizing massage in the U.S. because he wrote about it in magazine articles a lot, actually, and really promoted it. And promoted it for nursing and promoted it for all sorts of stuff. And John Kellogg is famous again for making massage. Famous in the U.S. In the U.S. We are all in the U.S. now. In Great Britain, around this same time, right around the turn of the century, the Society of Trained Masseuses, there's that word, by the way. It used to be an okay word to use. The Society of Trained Masseuses was formed by women in England. And it was formed out of necessity, by the way. Just to give you a little backstory here. Before this, all sorts of people were calling themselves masseuses, and they were doing crazy stuff. Sometimes it was illegitimate stuff. Sometimes it was just dangerous stuff. And the real massage therapists, the real masseuses at the time, said we've got to put a stop to this, and they formed the first professional massage association where you really had standards about care and things like that. It's part of the reason you guys go to school. If you didn't have licensing and we didn't have certain standards, anybody would be able to call themselves a massage therapist and they'd be able to do anything they wanted to, poke people in the eye and call it massage. And so that's why professional organizations start in the first place. And that's why this one started in the first place. And now we have schools and licensing to take care of that kind of stuff. We do have national organizations still that attempt to do roughly the same thing. Although now national organizations for massage therapy try to even raise the standards above state standards. So to be very honest with you, it's harder to get your national certification than it is just to get your Arizona license. But same concept, same concept. I don't think we need to worry about that at all. Eslint. Has anybody heard of the Eslint Institute in California? That's interesting that you haven't. It's a retreat center. It is still there today. Still there today. Retreat center started in the 1960s. And it really helped get the massage movement going. It really helped associate massage with mind, body, well-being, overall health. It is a super hippy-dippy place. If you ever want to go there, just be prepared for that. It's super cool, but they will have drumming circles. You will get assigned a random roommate. It's a lot about community. There's lots of naked people walking around. It's all in the up and up, by the way. It's all massage and stuff like that, but it's just very, very all natural and very hippy-dippy. But it really did help popularize massage in the United States. And I still know massage therapists that go there. They're like, it's the coolest thing ever, you gotta go. And study massage there and get massage there and all that kind of stuff. The Eslint Institute. Still around in California. Still there. Still go now. You look it up online. You can book a session right now. Rolfing. Let's talk about Rolfing for a second. Have you heard the term Rolfing? Good. Yes. Yes. Miss Monreal, please.
Yes, I have.
Okay.
Actually, that's one of the things I want to do later.
Good.
Is go to
Rolfing school.
the Rolfing Institute. Yeah.
In Colorado?
Yes.
Yeah. It's cool. It's super cool. Good. Well, this class is a good precursor for it then, because I'm a big Rolfing believer. So, Miss Walker, this is a good example of something you can't call yourself. Rolfing is actually a systemized approach to massage. It is a deep myofascial approach to massage, extremely deep, extremely powerful, and it is copyrighted. So if you haven't graduated from the Rolf Institute, you can't call yourself a Rolfer. They'll sue you. You can call yourself an integrated structural massage therapist. You can call yourself whatever you want, but you can't call yourself a Rolfer. It really is a copyrighted massage. it's kind of cool how it got developed. So a sweet, little, tiny old lady named Ida Rolf invented it. She had a son with a kind of degenerative disease where his fascia, his tendons, ligaments would shorten on himself, and he'd be kind of withdrawn like this, physically speaking. And she found out through very slow and deep and powerful massage in his attachments, in all the fascia and stuff like that, that she could actually loosen up that stuff and he could live a fairly normal life. And she was like, aha, I'm onto something. And she was. I would argue, by the way, that you can essentially do Rolfing now. You can't call yourself a Rolfer, but I meant if you are good with your anatomy and you know how to get in deep into the origins and insertions and ligament attachments around areas and things like that, you can do Rolfing. That's what they're going to teach you at the Rolf Institute. But it's that concept. And it has changed some today, but it used to be that there was only one place to go to the Rolf Institute. It was in Colorado Springs. And it used to be that they would not accept you unless you had been out of massage school for 5 years actively doing massage. They felt that if you hadn't done 5,000 hours of massage, you probably shouldn't even come and study Rolfing. And Rolfing is normally done in 10-session treatments. So if you come to me and I'm a Rolfer, which I'm not, but if you come to me and I'm a Rolfer, we actually will see you at least for 10 sessions. And they work on a section of your body in each session. So a whole hour maybe on just your neck, a whole hour maybe on just your sacrum, a whole hour on very basic things that are structurally important to your body. Yes, Miss Monreal. Yes, Miss Monreal again.
Sorry. So I hit the hand thing. I said, sorry, I forgot what I was going to say, but it's all good. And then I hit the hand thing again. So nothing. It was in reference to Rolfing, but I don't even remember. It's okay.
Oh,
My bad.
I'm going to miss you. I really mean that. Okay. So anyway, that's Ida Rolf. You should know what Rolfing is. It's a very powerful form of structural massage. You are trying to change the structure of how somebody is put together. Rolfers look for scar tissue that's deep in the body from past injuries and break that scar tissue up so the person can realign. It is powerful work. It is not relaxation massage. Not relaxation massage. My only, by the way, my only criticism of Rolfing is it might be too much at one time. So because it is so deep and things like that, I think some people might need a slower approach. Yes, Miss Monreal, did we remember?
Okay, yes. So I know that they do the 10-session thing.
Yeah.
But do you know how far apart they space the sessions?
No, I don't. I don't.
Okay.
And what's weird is I used to work for a Rolfer for a little while, and I don't remember how far she put her sessions apart. Yeah. And I worked for her as a massage therapist. I would do massage on her clients kind of between sessions and stuff, but I don't remember. It was so long ago. It was like 25 years ago. But yeah, I just don't know. I don't know. And I do know also, by the way, I'm oversimplifying. They do 10 sessions, but then sometimes they'll call you back for a follow-up session in one of the areas that's having problems. You know, it's not cut and dry. And I've never been to the Rolf Institute, so I don't really know.
Okay.
Yeah. Cool stuff, though. Very cool stuff. Oh, no. I'm not doing that to you guys. Some important organizations to know are the American Massage Therapy Foundation, still around, AMTA. You'll hear them. You'll also hear the ABMP, Associated Bodywork and Massage Professionals. And a big one you're going to hear of is the NCBTMB. And if I wasn't looking at my slide right now, I could never say their letters in order. But it's the National Certification Board of Therapeutic Massage and Body Workers. Why will you hear that one a lot? Because they offer a national exam, much like the MBLEX, for national certification. Now, don't get this confused. This is not a national license. In no way does this let you practice anywhere you want. But a lot of states require you to be NCBTMB certified or pass an MBLEX to get a license in their state. So if you are nationally certified and you want to move to Idaho, I don't know what the requirements are, but and Idaho requires that, that's what you need to do to switch your license over. So I do know people that get certified. If you want to talk to somebody about the process, we have somebody that works for us who got certified. I've never done it, but I have a substitute teacher here, Heather Denutil, and she'll talk to you about it and tell you what it was about. She said it was hard. That's what she told me. Miss Hunter, yes.
This is for the NCTMB, whatever.
Yeah.
That's the one you're talking about. I thought that was like absolute. Like I thought we only had to worry about NBLEX now.
I mean, most, I don't, by the way, the reason I'm hesitating here is I'm trying to remember, most places I've looked at I thought took either one. Most states I thought took either one.
Okay.
And from talking to Heather, I'll check with her again, but I thought she said the MBLEX was actually easier than the National Certifying Board of Therapeutic Massage and Bodyworker test was. And so you might want to focus on the MBLEX. But look up the particular state you want to go to and just look up reciprocity and see, or look up a couple states and see. But I was pretty sure that they'll take either, because I was looking kind of through them for loopholes for something else. And I remember just seeing lots of them saying you had to take either this or this. They would take either one. I don't remember one saying they would only take the NCB-TMB. So that's good news. I think it's either or. Miss Monreal?
Yes.
You have your hand up?
Oh, sorry. Gosh. No, I didn't mean to.
It's Thursday, I can tell, Miss Monreal.
I'm sorry.
Don't be sorry. You're fine. We need a little thing to break up the lecture. Okay. Another organization that is still here, and it's my favorite. It's the Touch Research Institute. It's in Florida. Established by Dr. Tiffany Field, who still works there as far as I know. It is really, massage is studied very little because pharmaceutical companies don't make money off massage. If they study a new drug, they can sell the drug. If they study how well massage works, they don't get to sell that. They can't sell you. So I'm not saying they're greedy or terrible or whatever. I'm just saying there isn't a lot of research done on touch. Well, the Touch Research Institute studies the effects of touch. And they have some of the finest research out about the effects of touch on people, of massage on people. They've got some of the best evidence of why massage works and how well it works, and that it really does work. They've got the evidence proving things like, they've studied maternity massage, and they've got hard evidence that people that receive massage while they're pregnant have easier labor and birth. Dramatically easier, with less drugs. Dramatically. And that's because they studied that stuff. So I love Dr. Tiffany Field. I love the Touch Research Institute. If you ever want to go online and find good evidence for massage, they're one of the few places to find it, because they're actually spending the money to do it, to actually look at the effects of touch on human beings. And I love that they look at massage therapy, but they also just look at touch, like how important it is to be touched and such. So they're amazing. And they link it to very well done studies that are not funded by external forces. They can manipulate the study, that are really doing scientific studies to figure out, does this make people's lives better? And is it significant? And they're great. So that's the Touch Research Institute in Florida, founded by Dr. Tiffany Field, who still works there. Don't worry about any of that because no. Okay. That's it. That's it. That's an overview of the chapter that I know you all read in gory detail before you did your questions and such. Yeah? Okay.